A lot of our TMJ patients ask how long their treatment will be or what's involved in treating their TMJ pain. And some cases can be very, very simple. This patient has been suffering with TMJ pain for years and years, and it just turns out that it's something as simple as a tooth misalignment. So it's really simple to fix. And the way we do that is we use articulating paper. We'll put Vaseline on each side, that's what you just saw. And we basically check what teeth are coming together. And the ink will deposit wherever the initial contact is. And then what we want to do, you can sort of see it right there. What we want to do is just adjust these little spots to his bite so that he's biting evenly. So I'm just simply going to do that right now. And then the articulating paper can come in different colors and different thicknesses, and so I'm able to check and basically adjust until he's really even everywhere. You can see here, it's still a little bit heavy on those two teeth. He's barely touching anywhere else, so I'm going to keep adjusting. And sometimes what we can do is just use a folded articulating paper just to really feel each separate contact. This gives me an idea of how much the teeth are holding that paper, and wherever I felt the most tug, I felt it the most here, I'll adjust that out. So you can sort of see it right there against the upper tooth here. So I'm going to adjust this lower tooth because it's the lower tooth that's in the way of his bite. And the other thing we can also do is check with shim stock, which is very, very thin. And you can see where the paper comes out, means there's no contact yet, and where it's held up, there's contact. The other thing we can do is open this up and then find out how he slides. So I'll also do that to find out where the interferences are and keep adjusting until we've got everything on the canines right there. So what we want to see, just so you get a clear idea, is check for canine guidance. So put the paper in the back and the canine should guide the bite on the slide, which means the paper should come out without touching any teeth. And same thing here, just behind the canine, slide this way, and there's a slight interference right there. I'm gonna find it again. Clean off the ink when there's too much. And we've got contact right there before the canine is able to guide it. So I'm going to adjust that out on the slide. And that's the buccal cusp interfering on the ink line. Check that again. And now we're free on that, and the canine is guiding the bite, so that side is done. And we do the same thing on the other side, and then essentially, as long as the adjustments are very minor, we can do that on the patient, and they're done.